Welcome to MeloTV, and joining us in studio this week is Annette Bing. She's a certified lactation consultant, or I would just say she is a specialist and also a midwife. Thank you so much for joining us right here on MeloTV.
It's a pleasure. Thanks for having me.
For a new mom, it's always excited when you are pregnant. It's 9 months, a little bundle of joy comes, beautiful day it is, but those 3 days in hospital, it's a very difficult time for a first-time mom.
It is. It's extremely overwhelming, especially if you've never had a baby before and you've never breastfed before. You've got lots of challenges coming your way. You don't know what kind of birth you're going to have, how your baby is going to respond to latching and feeding, whether they are born early, in neonatal ICU, whether they're separated. So lots of challenges to deal with. But an exciting time. It
is a wonderful time. Mom gives birth, dad is there with mom, and then always they give the dad the opportunity to have that skin to skin, to bond for that 10-15 minutes while mom is being sutured up. You know, they're taking care of mom, and then dad bonds with baby first. And now comes that beautiful time when mom gets to bond with baby.
So the skin to skin is actually really important for both mom and dad, because it's not just the fact that we are regulating their heartbeat, their oxygen saturation levels improve, their respiration rate improves, and that goes for both mom or dad's chest. So if mom is being sutured up with a vaginal delivery or a cesarean section, well then I really encourage dads to unbutton their shirt, pop their baby on naked or maybe just with a nappy onto their chest so that they can have all those regulatory effects of skin to skin. Plus they're exposed to the mum and dad's microbiome. It's all their good bacteria, which then helps seed their future immune profile. So dads mustn't feel redundant, and it's a really important job, and they get to have that bonding too, because it's just as important.
Dad's there with the cell phone in theatre, or you can't imagine what's happening, because we as men, we don't know what women go through. But women play such a big role besides carrying the baby, and then it comes to having the baby and then having to latch when they have to breastfeed, because that's a daunting time for any mom. Will I have enough milk? Will my baby drink? Will my baby eat?
Yes, so it is hugely daunting and very overwhelming, and so we really need the dads to understand their role in supporting the mum. So during hospital, obviously just coming to support, to visit, to assist with latching, helping with baby, changing nappies, whatever they can do to assist. If mum needs dad to go off and go and buy her some products or items or whatever, that's a role that they can do. And obviously when baby comes home, then mums really need the dads to support them so that they can heal from their cesarean section or their vaginal delivery, so that they can get support with burping the baby, sterilizing equipment, sorting out meals for her. You know, if she's got that support, she's got time to recover, and she's got time to establish the feeding, and she's got time to cope with the adjustment of lack of sleep, exhaustion, overwhelming. So that's really what the dad can support mums with.
Our guest right here on MeloTV is Annette Bing. She is a certified lactation consultant, I would say a specialist, and also a midwife. You went to the UK to do a bit of midwife and to study?
I did. I was very lucky. I went across in 1997 and I stayed for about 6.5 years, and I worked as a caseload midwife that specialized in home births and water births, and really my passion was lactation. So when I came back to South Africa, I then did a course to certify, and that really has become my main focus in my practice.
Let's talk about that role that you play as a midwife and a certified lactation specialist within the Malamed group.
So I like to be involved with the antenatal classes so that I can already start discussing lactation and the challenges mums are going to face and what is normal and what can be expected. If we discuss it antenatally, it just helps prepare parents a little bit prior to the birth and what's to be expected. And then obviously we're trying to get information to the parents once they've delivered, just to kind of support them in that journey during those first couple of days in the hospital. They've obviously got the staff, the midwives, the healthcare assistants in the hospital to help them. So they need to utilize that as much as possible for every single latch if they need, until they feel confident going home. But what we're trying to do is to discuss and cover all the topics of the challenges that they are probably going to deal with in those first 3 days.
There are so many questions that parents or moms to be have. But I know you brought a few props with. Let's talk about positioning, latching, very important. There's also feeding from teaspoons, syringes.
Sure. So I think let's just talk about position. So I can just quickly chat about how to get the best position for latching.
Yeah, I'm just preparing to show us about positioning because moms always don't know how to keep the baby. The head is tilting. It's flimsy, and you're so scared you're going to hurt that little angel of yours.
Yes. Positioning is probably one of the two most important things when it comes to breastfeeding, positioning and latching. So it's really important to get that right. You want to have a very firm supportive cushion to start with. Okay, so a feather pillow that's very soft and collapsing is not going to support the head and keep the head exactly where it needs to be. Okay, this is a great position, just this cross cradle position for latching. You want the head to be well supported at the same level as the breast, where the nipple naturally falls. Okay, if the head's not supported, baby will lose that good deep latch. They'll start losing the latch and develop a shallow latch. Shallow latching causes nipple trauma. So the deeper the latch, the more well supported the head is at exactly the level that you need it to be, then you're starting off in a good position. Okay, so in this position, you would then normally take the bottom arm and put it underneath the breast so the baby's not struggling and fighting with you. Get something soft and bulky underneath the baby's head just to support it exactly where you need it to be. This is just one option of a position. If you're battling to latch the baby, you can then do a football hold, which would be just moving the cushion around in this direction, put another supportive cushion behind your back so that you've got some space, and then you get your baby in a position and you can have a good grip with this hand, and then you can latch the baby in this position. So that's quite an easy football hold, as long as you've got good support behind the shoulders and the head, and good support here so the baby's not slipping and losing that deep latch.
And you won't be hurting the baby in these positions?
Not at all. As long as you are supporting the base of the neck, then baby's head can't flop back. We try and avoid holding the head because they're highly sensitive to stimulation. So as you're holding here, and your fingers on the side, they start rooting towards what's touching their cheeks. So we actually just try and avoid that and just make sure that we've got some very good support behind their head. So that's a great feeding position for mums that are battling to latch. Then we try and get them into this football hold.
Now, Annette, we spoke about latching, positioning, but moms would want to know the frequency of feeding because baby cries and you'll just think, hey, let me feed my baby. He or she is hungry and that's why they are crying. How often should you feed your baby?
That's a very good question because a lot of the mothers are not quite sure, should we leave our baby to sleep? Are babies getting enough? So the guideline would be on demand as frequently as they wake to feed, but at least every 3 hours. That way we are maintaining their blood glucose levels, we are making sure that the breasts are being constantly stimulated so that we can get the supply to where it needs to be, around about day 3-4 when the milk comes in. We're not skipping a beat with that stimulation. For the mums, they really need to observe baby's feeding cues. So prior to baby crying for a feed, they will already start showing behavior of beginning to turn their heads and rooting, looking for the breast, their mouth opening and closing, sometimes sucking on their hands, just a couple of early warning signs. And if your baby's rooming in with you, then it's ideal because you don't miss those cues. So quite often they don't have an awful lot of energy to give you, and if you can start seeing the pre-feeding cues, then you can latch them on before they start becoming frantic and crying. The number of times to feed would be 8 to 12 times in a 24-hour period, but at least every 3 hours.
You are a mom yourself, 2 boys, and being with other moms, it must bring such great memories for you too, and being so close to babies.
I think it was the most exciting journey for me ever. I had lots of challenges with breastfeeding, overcame them because I was really committed. It's a hard job. No one else can do it for you. So I understand what mums are going through. I understand the disappointments and the failures when you feel like you're not getting it right, when your supply is low, when your baby's not latching. So it really is important for mothers to feel supported and to understand that breastfeeding looks different for every mum, and if babies are really not latching or it's just too painful or you're just not enjoying it, there's always options of exclusive pumping, other methods of feeding your baby, but still being able to give them breast milk. So, it does look different for every mum.
Our guest is Annette Bing, a certified lactation consultant specialist and also a midwife, joining us right here on MeloTV. Annette, we're talking about nipple trauma. You get cracked nipples, etc. Women don't want to breastfeed because they're worried about how their breast is going to look afterwards.
Yes, so nipple trauma is always due to poor shallow latching. Okay, so that's the first sign. If a mother's battling with nipple trauma, obviously we expect some sensitivity, but nipple trauma, where it's actually becoming cracked and broken down or bleeding, means that we need to assess what is going on with the latch. There could be reasons like baby might have a tongue tie or a lip tie that needs to be assessed. It could just be very shallow latching, so mum needs to be taught on how to get a deeper latch. It could be a poor fit with regards to the nipple being too large for the baby's mouth if they're prem. So there are various reasons. Seek help to get it rectified, and then the nipple trauma will stop and then the nipples can heal.
Also, I know I've read about it too, that some women you can use cabbage leaves. What does that do?
Yes, so if you're battling with engorgement, so that would be like day 3, day 4, when your breasts are quite hard and full and the milk starts coming in and it's very congested and painful sometimes, that the baby then is slipping off to a shallow latch because they can't get a deep latch. So really, we want to advise mums then to do some good warm compresses, heat up that breast, massage to stimulate it, bit of hand expression, soften the breast, and then get the baby onto latch. And that engorgement phase, you really want to just drain the breast as frequently as possible to get past that phase. Cabbage leaves are great because it's a cold compress, so you can take that out the fridge. It happens to be the shape of a breast. Rinse, pat it dry, pop it on, and you do that 3 times a day just to give some good relief for the inflammation, and then take some oral anti-inflammatories 3 times a day, 8 hourly, also just to help reduce that inflammation. Intravenous fluids in labor, epidural, cesarean section can make the swelling and congestion during the engorgement phase that much worse. So you can almost anticipate it.
Our guest is Annette Bing, a certified lactation consultant specialist within the Malamed Group. Annette, frequency of feeding. Moms have babies crying, and all they think is, I need to feed, keep the baby quiet, but a baby's stomach is only that big, or let's say that small.
Yes. So the stomach capacity of a newborn in day 1, first 24 hours, is 5-7 mils. We're talking about 1 to 2 teaspoons. So it's minuscule. So we're not asking a lot, and to meet the baby's requirements is not a huge task. So really, in the first 24 hours, we're looking at 1 to 2 teaspoons. If the baby can't latch, then we ask the moms to try and do a little bit of heat therapy, massage, hand express, and then there are other options for how we give that feed to the baby. We can use syringes, a teaspoon, a cup feed, a finger tube feed. There's lots of other methods to avoid a bottle and a teat, to avoid the nipple confusion. So there are lots of methods, and in the hospital they've got all of those devices. You just need to ask for help, and the staff will bring and come and support and assist you.
Now, as a certified lactation specialist and a midwife, how do moms get hold of someone like Annette Bing?
So there is a South African Certified Lactation Consultants website with registered lactation consultants, so they can have a look on that and search to find a lactation consultant near them. If they are battling, they can always contact me and I can put them in touch with somebody who lives close to them. I serve the Tokai southern suburbs area. I also do consult back at MeloMed, so MeloMed Tokai will always make a room available for their clients to be able to come back and have a follow-up lactation consult. I offer Zoom online lessons for somebody who just doesn't live anywhere near a lactation consultant, but it's important that they get some form of help, because if they're battling and they've got cracked and bleeding nipples, they just need extra support.
Moms are amazing people, but Annette Bing, there are those that are going to fear, they're going to stress themselves out, and then obviously not going to be able to have enough breast milk. But what advice do you have to those moms that are just a bit stressed out when it comes to having to breastfeed their child?
So it's always difficult to trust their bodies to be able to do the job and to know whether their babies have had enough, and this is the same for every new mum. If your baby is gaining weight well, and thriving and transferring milk and swallowing. That's how you build confidence. In MeloMed, they get handouts, breastfeeding handouts. They get access to a lactation consultant. The mums just need that kind of support to be able to build the confidence that their milk is transferring, that it's enough, that the baby's gaining weight. Those are all the confidence boosters that a mum needs.
And just quickly also, what about getting rid, you spoke of it earlier, getting rid of the breast milk, storage, etc.?
Okay, so...
Or how often should you pump?
Okay, so pumping really is for if you've got a low supply and you're trying to stimulate and add, besides baby feeding, on top of that, do some extra expressing to stimulate your supply. If babies are battling with weight gain and they need top-ups, then obviously we encourage mums to express their own breast milk, to use that as a first choice before formula. If mums are needing to go back to work fairly soon, which in this day and age lots of mums do, then at some point we need to, within a couple of weeks of birth, start actively expressing to start building up their supplies in their freezer, so that when they go back to work, they can continue their breastfeeding and the baby's exposure to breast milk for as long as they can.
And finally, what advice do you have for new moms to be, or moms that are still maybe struggling to, with breastfeeding, and especially dads?
I think that they really need to know that there are support groups out there, and mother and babes groups, and places that they can reach out to feel supported, not be isolated. And if they are having ongoing issues with feeding, or they need to know how do they store their breast milk and how do they express and go back to work, how do they manage that transition, they can seek help, they can have a consultation. If they need to know how to transition from milk and breast milk feeding to formula feeding to go back to work, or to introduce solids, there is help out there. Organize a clinic consultation, go to your nearest clinic, find out where to weigh your babies, find out the mother and babies groups in your area. It shouldn't be an isolating experience.
Our guest this week right here on MeloTV is Annette Bing, a certified lactation consultant, or I would say a specialist, and also a midwife within the MeloMed group. Her details on the screen. If you need to reach out, please email her, please contact her, and just seek help. From all of us at MeloMed, thank you for watching this episode, and until next time, take care of your loved ones and take care of yourself. Goodbye.